Hello, I'm Kathryn Jean Lopez from the National Review Institute and National Review Magazine, and I'm so grateful to have with me Dr. Jonathan Ellen and Francesca Merico, a children's rights advocate. We're here to talk about the AIDS in Africa program, PEPFAR, and some of the programs that in the midst of very well-intentioned reforms, we're kind of losing sight of as policies are changing, as far as our foreign aid goes in the United States. PEPFAR in particular, George W. Bush's AIDS in Africa program has saved so many lives, and not only that, but changed the culture. And it's a real example of how to do not only foreign aid, but civil society, and really help people flourish on their own with the resources they need to live. And anyway, so in a piece on National Review's website, Aid to Fight AIDS is Money Well Spent. Dr. Ellen talks about this. Can you start us off talking a little bit about your experience with PEPFAR and why it's important to reach out, particularly to the administration and conservatives about this issue?
Yeah, so I'm a pediatrician, so talking about child health is near and dear to my heart. But I'm also a person who's been involved with public health around STIs, including HIV, for almost 35 years. And I have watched the ability to turn HIV into chronic disease and to prevent maternal child transmission. And that has happened over my time that I've been involved in the field. And when PEPFAR came out, it was an amazing thing because the idea that we would supply resources to under-resourced countries and have an impact on the treatment and then in some instances the prevention of transmission in all around the world, initially in the biggest continent being sub-Saharan Africa, where we see the biggest burden of infection. And PEPFAR has been an amazing success, as you mentioned. I don't know how I got lost there.
Yeah, I don't know either. We'll fix it.
I
You
got,
can keep talking.
yeah, no, you guys
Yeah,
took
of
me off.
course.
That's what happened.
Yeah, I think that's what just happened.
Okay, sorry.
There we go.
And and what's amazing to watch around, particularly the treatment side um, of HIV, and I've watched it go from having no treatment and just testing, just so you could aware of what your status was, to having effective therapy for people who are infected, to going to a point where we learned how to prevent transmission. And it's never been one of the places that it's shown up the most is in the protocols around treatment to prevent maternal child transmission. Because when they first started doing the work to show treat, treat the mother around the time of delivery, that there was some hope of preventing transmission. And like anything else, like we did with cancer, you hit them hard and you hit them long. And the big worry at the time was that there would be continued transmission from breastfeeding. So, but what happened over the last decade and a half is we learned that we could suppress someone's ability to transmit infection by giving them enough medicines or antiretroviral therapies at the time. So we've now been able to come up with a very streamlined protocol for treatment, both in terms of people who are infected, in terms of prevention of infection and transmission, and that extends to maternal child health, maternal child transmission. It is a very complicated system to do the prevention and the treatment of HIV. You have to be testing, first you have to be outreaching, then you have to be testing, then you have to have adequate people who are trained to treat, and then you have to have adequate accessibility of the medications. So there's a whole infrastructure, a whole type of support that is necessary to provide treatment. PEPFAR comes along, and this is back before we had all this really reduced down kind of treatment guidelines and prevention guidelines. And it makes medicines available. It makes antiretroviral therapies available. It starts to build capacity in the countries to be able to treat. So test and treat, test and treat, test and treat. And if you think about this maternal to fetal transmission, the big thing, or child transmission, the big thing to think about is it's a complicated system. You've got to be able to find the mother who's test her, treat her, and then after the child's born, make sure they're being treated. So that is like a 4-part, 5-part system. PEPFAR has really built a whole system around that. The advantage to the US of investing in PEPFAR in other countries has been, one, what you point out to is a humanitarian and a very important way of not just extending soft power, but also doing good work. It's effective. There's no questions about its effectiveness. If you look at the number of people, lives who have been saved, you look at the number of cases prevented, it's effective. And there's no question about its effectiveness. We're not talking about behavioral promotion and behavioral prevention. We're talking about treatment with medications that are effective. And it's also helpful because without treating it, and this is what I mentioned in the article, and one of the things that President Bush, when he was pushing this forward, wasn't just the humanitarian side of it. It was also the fact that it was a security issue. It
Mm.
was an economic issue because HIV was ravaging the subcontinent of Africa in such a way that it was going to hurt U.S. security, U.S. access to mineral resources, U.S. capacity to buy and sell goods with Africa. So there was that aspect of it. And I think we're pointing at now is that with the gutting of USAID indiscriminately, so you can argue for different parts of it being cut, but the gutting of it indiscriminately, when you have an administration who has said that they want to continue PEPFAR. So there is budgeted money for PEPFAR, but the cutting that was done by DOGE and by those people working for DOGE that in USAID, even when it got moved into state, really did a disservice to what I would argue, reading between the lines, is the White House's intention, because it's in the budget, to continue to treat and have PEPFAR go forward. As I described earlier, the complicated system of treatment, outreach treatment, and prevention that needs to happen around all these different aspects, particularly maternal to child transmission, requires a complicated infrastructure and capacity, and that's what got cut. And the question becomes, how do we restore that? And that's kind of what the article is about. A little
And
long-winded, I'm sorry.
no, I think it's really important to set the stage. I've had a couple of conversations in recent days, weeks now, where, we remember well, and you intimately, when this all got started, when the pandemic was happening in Africa, and Bono and George W. Bush are advocating together, and Rick Santorum, odd couples were really, this was really an issue that brought people together. But I talked to reasonably well-informed young people who don't even realize that, this changed the world in many respects. And George W. Bush should have gotten a Nobel Peace Prize for that, but that's another issue. But Francesca, can you talk about, because you're seeing part of what Dr. Ellen just talked about is the chaos that is kind of happened because of what DOGE has been doing, and the people who have gotten lost in the mess of this. What are you seeing, and what is kind of your plea, your practical plea to American policymakers who have the power to fix what has been broken here?
Okay, so I have several pleas, but What I want to start by saying is that I'm really grateful that I've been part of programs that are supported by PEPFAR, and I've been working primarily with faith-based organizations around the world. And just sharing a little bit my experience, back in 2005, I was in Vietnam with the Chameleons, which is a Catholic order that of nurses and priests. And we were in a shelter for children and young women. There were young girls, actually, 14, 15 years old, living with HIV. And it was hard to find treatment. And what we were doing, it was using adults treatment for the children, for the babies. And many of you have heard this by others as well. But we had something, and that something was coming actually from the support of the US government through the embassy in Vietnam. And other places, Comboni Sisters in Kenya. And there we didn't have access to any treatment for children. And what I could see, and we were spending time with the children, and what is beautiful about faith-based organization is that you see nuns, you see sisters that stay with the children, accompany the children until the very last minute also of their life. And I could see the void in the look and the side of the children, because without treatment, without nourishment, there was really no hope. They had no energy. And then things changed, and things changed really thanks to PEPFAR and what PEPFAR brought in terms of antiretroviral treatment and formulation for children. And now we have excellent formulation for children. We can still do better, but we have excellent formulation. So for that, really, for those people who have spent time with children around the world, with children living with HIV, we can see the difference. And we are really grateful for that change that the American people have brought to humanity and people around the world. My plea is no institution and no organization created by human beings is perfect. And we make many mistakes when we can always improve. But, these days I was really thinking about the Sistine Chapels in the Vatican. And that is a magnificent place with those beautiful paintings. And I was just sort of comparing, just imagine if those paintings needs to be adjusted because due to time they are a bit deteriorated. And instead of working on them to improve them, imagine just cover them up. It's like ruining and throwing away and wasting everything and the beauty created by human being. And somehow my mind, I was comparing this, what is happening now with PEPFAR. We cannot allow ourselves to waste the incredible work and progress and achievements that have been made through the years. Because children or the most vulnerable are those who are going to pay the most for this situation and for these abrupt changes. Improvement requires time. So what we need and require now are real effective transition plans for sustainability. We cannot just cancel and delete the work that has been done, delete and eliminate organization, fire people this way. This is not acceptable because it's not going to help anyone and it's not going to help and improve the situation. So this is my plea, that we just not cover up these paintings, but we find ways to really give them light and improve them to be more effective for the people we are supposed to serve.
Can I ask you, Francesca, how did you get involved in this work in the first place?
I was working at the permanent mission of the Holy See in Geneva, supporting and working engaged in the Commission of Human Rights. At that time, now is the Council on Human Rights, and also supporting the work of Monsignor Robert J. Vitillo, who is currently at the Dicastery for the Promotion of Integral Human Development as an advisor for health. And he was the person in charge of health and HIV at the permanent mission. And he needed support. At that time, I was doing my master on children's rights. I always had this passion for children. And he really convinced me to work on HIV and to be engaged in HIV. And that's why my work and internship with the Chameleons and the Comboni Sisters And that's the way I've started. And I've met the people, I met the children, I met families, I've met mothers who were just giving me their children and saying, please take them. We cannot take care of them because we know we're going to die. And then I really saw that from that we passed and we moved to something incredible that is giving hope, returning hope to the life of family and people. And for that, I am really grateful to PEPFAR and the American people. And so that's the way I've started. And then I've continued with Caritas Internationalis and then WHO, PEPFAR, UNITAID, several organizations, the World Council of Churches. I mean, it's really been a journey. And I also had the pleasure and the privilege to coordinate the PEPFAR UNAIDS Faith Initiative, which unfortunately has ended this year because of the current decisions of the US administration. And that really, I think, is a big mistake because leveraging and working and creating partnership and collaboration among different faith groups, I think is key to the sustainability of the HIV response, but for health and global health in general.
I often think of a quote from the late Rabbi Jonathan Sacks, where he talked about how the best ecumenical work in the world is the work on the front lines in crisis situations like AIDS in Africa and other pandemics and health crises. Dr. Ellen, some who generally support DOGE and the need to clean things up point to, among other things, there was Francesca mentioned nothing's perfect, but even Congressman Chris Smith, who has been an advocate for PEPFAR for the life of the program, has raised questions about abortion being involved during the Biden administration. We know of one incident at least, and you assume there are other things that happened. What is wrong with the idea that people have, all right, just end it and start again? Obviously, you've mentioned a little bit, and Francesca has mentioned there's so much infrastructure and institutional memory, and why can't you just start again?
Well, let's figure out where we are. First of all, it's been stopped. Let's just be clear. We're not at the debating whether they should be cutting or
Right.
they will cut. They've cut.
And could you explain? I'm sorry, I'm asking a
Yeah,
lot.
that's clear. That's fine. That's
There's so
fine.
much to talk about. So what does it look like if you're a health clinic, a mission in Kenya or pick your country.
Let's
Uh,
take Francesca's work. She's working with people who've been funded by by USAID to implement PEPFAR. You turn off the spigot to USAID, whatever tools they had in their hand, there's no one holding the tools anymore. So let's take an example. Let's say we bought, 10,000 doses of nevirapine. I'm just making it up, okay? It's sitting right now. No one is there to give it out. And so when I hear, I think how we got here is almost not, I mean, it is what it is.
right.
But the thing I almost think they should be appointing a czar who aligns with Rubio in the White House so that you don't have this back and forth, who starts rebuilding or very consciously and intentionally figures out what aspects of the treatment, the prevention, the diagnosis, and the treatment is essential. And I don't mean like bare bones essential, but essential to be able to start to get the infrastructure there and consistently. It is a very intent to fix this right now is going to be a very intentional process. And it's going to take someone who understands what happens at the front line, giving back to what the two of you are talking about, who understands the countries and understands that there is an infrastructure and a capacity that is necessary that aligns with US and White House values around delivering antiretroviral therapies and prevention therapies to children and adults. And if you said, look, we got rid of it all, we painted over. Now you have to someone come in and start chipping away at the paint that you put over the Sistine Chapel. And if you decide someday that you do not want a bear cherub hanging out. You can debate that later, but let's get the painting open again. And I think there's going to have to be a very intentional, and I think this is what Rubio wants. I think,
Yeah,
but
that's
I
the
think
impression. Yeah.
I think the people who helped Bush get there, there was the national security people, there were the HIV people, and there were the faith-based people. They're the people that pushed PEPFAR forward in the first place. And I think if it wasn't for the faith-based people, it may not have pushed it over the finish line, to be quite honest, when it came to PEPFAR.
Yeah.
The
Yeah.
same coalition needs to get together again and get together with Rubio and get together with Secretary Rubio and given where he's part of that coalition, by the way,
Mhm.
and start pushing and start going through program by program. This, if the same way they went program by program and got rid of it, and start putting the pieces back in place that will allow the part that's most effective, which is for children, for pregnant women, and for adults who are infected, to keep them healthy and alive.
And as you say, I think that Marco Rubio is an ally in this. I think that he can save lives, and I think he wants to. And so is what you're describing possible to do? And what's the window? I mean, there are real lives that are
They
being
have to do it now
they
because,
have to do it right.
yeah,
Well,
I
they
mean,
had to do it yesterday, but
yeah, but they have to start tomorrow. And the reason I say that, and Francesca was pointing this out exactly, is that every day that you go by that you're not fixing it, it disintegrates. And the more it disintegrates, people go, let's just say you were working in a clinic in a small rural area in Zambia. And now there's no funding, there's no salary, there's nothing. What are you going to do? You're going to go home. And let's say your home is, 800 miles away. You're getting you back is not as easy as just, you know, and so every day it disintegrates, the capacity disintegrates. So we got to get on it. How long is it going to take? Look, they were able to go through with, and I don't want them to do it, but they'll go through AI and they can figure out the programs just as quickly that they cut because they didn't like what it said, as they can figure out what they should be restarting. But
right.
they need a team. They need the you know, the restart PEPFAR and the elements of USAID that are tied to PEPFAR need to be restarted tomorrow. And if they have the intention to do it, look, they know how to turn the spigot on and off. They just have done it. I mean, they know how to, the DOGE team has taught us they can turn a spigot on, they can turn the spigot off.
Mhm.
You just need somebody whose job it is and who has the authority to do it.
And there is confusion, I think, because there's been talk of waivers and things, but my understanding is like if you fired the person you're supposed to get the waiver from, there was no waiver. It just doesn't really work. And yeah, so there's it's a bit of it's a bit of a mess, but as you say, it's in everybody's best interest. And in the process, as this chaos is basically ongoing, what I don't want to sound like, some kind of protest chant or something, but real mothers and babies are getting lost in this whole process and potentially
There,
dying.
there are babies born in the last 2 weeks who are going to be infected. That's just the end. That's just they're going to be
And
infected and they're gonna die. I mean, that's just going to happen. It's happening right now. I mean, every
right.
mother who's a week away from delivering, who's not on antiretroviral therapy or doesn't know they're positive, that child's getting infected. It's just happening. 50% of those kids, I mean, that's what it was in the old days, 50, 60% untreated mothers, babies were infected. That's
So
it.
are we really, I mean, unintentionally, but are we undoing all the good that we've done?
Hmm.
Yeah.
Yeah. But
Francesca,
I'm
oh, go
hopeful that
ahead.
they can fix it. I just want to be clear that what they've been able to demonstrate with DOGE is that you can
Right.
make things happen fast if that's your intention. And that's why and so when you say they couldn't find the person to do the waiver, based on everything else, they don't wait for the waiver. You know what I mean? Like
Yeah, yeah.
DOGE did not wait for the waiver. DOGE did not wait for the minister to give 90-day period for changing rules. So there's no and so there's no reason to think you can't do it in the opposite direction if it's for programs that are supported by Rubio, Secretary Rubio, and President Trump. If this is something that they want to have happen, and by the fact that PEPFAR is in the budget,
Right.
and that this is a very directed program. And if you want to sit and filter through the programs that are adjacent to what is necessary and say we're not gonna refund them, we can debate that. That's like I said about the cherub, but
Right.
definitely can restart the outreach, this testing, the treatment, and the prevention of transmission. I don't know. I'm pretty adamant about this.
Yeah, well, and what I keep thinking, it's a different thing, obviously, and silly in a way, but true. Elon Musk figured out a way that NASA couldn't to get astronauts from space. He can figure out how to restart this program.
That's my point. We've learned that you can do things fast, and there's
Right.
no reason why somebody sitting down and going through all the programs that are related to this couldn't turn it back on in a week. It wouldn't surprise me if it could be done.
And one of the controversies back in the day, when we were debating PEPFAR and talking about and it was being developed was there were some faith-based groups who were worried about condoms being involved in the behavioral kind of aspect of it and the prevention aspect of it. On the abortion point, are you worried that that's widespread? I mean, culturally, it can't be, right?
It's not widespread. I
Yeah.
mean, in terms of abortion, there's no reason to believe it's widespread tied to this program in any way.
Right.
Okay. So that's number one. Number two, once you get back, whether you want to talk about getting to behavioral prevention works with condom distributions, we can debate that. And I will, that's a debate that I think is a legitimate debate to have. I know what I believe, but that's a legitimate debate.
Sure.
The fact that testing and treatment and the prevention of transmission is effective and doable, there's no debates about it. There's no debate there. And that's where there should be no debate, unless you just think anything you do outside of this US is bad. And that's not what Secretary Rubio, or the president, by keeping PEPFAR in the budget, is saying to us.
And, in addition to that national security point you make, I mean, you have to say it loud and clear. This is the best of America,
Yes.
a program like this. And Francesca, can you help give more of a picture of what you're hearing from people who are pretty much their whole infrastructure and lives and ministries have been upended by what the U.S. is doing right now? What is their daily life looking like? What are they saying to you?
Yeah, I think this is a very important question. I was on the phone with a friend of mine with so I do a lot of interfaith work as well, and she's member of the interfaith network of religious leaders living with or personally affected by HIV in Irala Plus, and there are about 5,000 members in Kenya only. And she called me and she was sharing, she's a person living with HIV, and she was sharing that, the clinic where I used to go is closed because it's a clinic it was funded by USAID, and it closed. So I was informed that I had to move to another clinic, which means going long distance. And so she reached to the governmental clinic where some of the staff lost their job because also the staff was supported by US funding. And it means that the staff remaining is overwhelmed. They are not used to deal with people living with HIV. Stigma and discrimination are still very present. People have to wait, and waiting in lines for a long time means you might lose your job. And how do you justify your absence for so long? Then she was given treatment. Usually she got treatment for 3 months. She got treatment for a month enough. And the moment you get treatment for a month and a half, so a reduced rate, amount, you start feeling scared because you start doubting that next time you go back, there will be treatment. And the moment, treatment is makes miracle, but it's not enough because you need to know that there's going to be more treatment, and you need to have that support system in place that support you to continue on antiretroviral treatment, on medication. You need to know that there is hope next. And it's like we are depriving people of that hope and desire of living. She's also shared with me that a lot of the women living with HIV, especially the young women, were peer support mothers, meaning that they were accompanying other young women who just recently discovered they were HIV positive, or who are in a situation where they risk to become HIV positive. And she said even that they lost the support that they were receiving from USAID. And therefore, there is no support for young women and young mothers. And then again, the risk of HIV spreading among young women, but also of passing to their children, to their babies. So that is what people are sharing: fear, confusion. They are not sure where to go. They don't know how to support other people. PEPFAR and the US government has created such a great support system, such a great opportunity for people to live and strive and live healthy. And now we are suddenly taking everything away from them. So this is what they are sharing. In terms of faith-based organization, a lot of the faith-based organizations have lost their funding, and not just for HIV. And that's the beauty also of faith-based organization. It's an holistic provision of services that goes beyond treatment. And so nutrition support has gone, housing has gone, and so this situation is really of despair, and there is chaos and confusion. And yes, there was a waiver, but again, as you were saying, when the staff is fired, then medication cannot reach people, food cannot reach people, and that's really a problem. Is a death sentence.
So you're really dealing with reality where there are people who have lost their homes because of what we're doing in the US.
They lost their jobs. They lost the clinics. They lost the support. They have no access as they had before to medication. And HIV is a virus that thrives in this. It's like we are creating the perfect condition for a virus to go back to what it was in the past.
Yeah, and can I just make a comment about
Yeah, I
that?
was just going to ask.
One of the pieces. So, we talk about one of the problems with the problems, one of the advantages or disadvantages of a global world with easy travel. One of the issues is if you let a pandemic spread, it will come to your shores. So there's another piece to this whole story, which is despite, given the despair, given the inhumanity of what's happening in places that have been supported by PEPFAR and USAID around HIV and AIDS, it will spread. I mean, everything that we've done to contain the infection through treatment, because treatment also stops transmission, it stops the spread of infection. It will spread. And because we have a global world with airplanes that fly back and forth, that you will end up with what we could start to see as the epidemic return to the US at a rate where it's more generalized again. So there's also
that's not alarmist to say.
No, it's not. The point is that it matters. I mean,
yeah.
There's the humanity part that
but there are selfish reasons to.
Well, but that's what
they
and there's one other point that comments. One of the comments, or a couple of people made comments on the article on the website, and one of the comments was, "Why is the U.S. the only people doing this?" And the truth of it is that a lot of Western Europe. I mean, they're committing resources out there as well. I mean, it's not a purely U.S. fighting HIV around the world. There are partners around the world that worked with USAID that worked with PEPFAR. And so it's not, I mean, when people say, why are you the only ones who care? We're not. And I bring that up only because the people that sort of say, well, we shouldn't be doing this because we're the only ones. No, that's not true. We shouldn't be doing this because it's not in our self-interest. That's not true. We shouldn't be doing this, and we should be doing it because it's the right thing.
Mhm.
And we need to get it started again. And I know I'm being more technocratic, and Francesca's doing a beautiful job of describing the reality of it.
Yeah, you're complimenting each other.
I just really believe like you said, we've been shown this could get turned back on. You know, someone has to just sit down, have the authority to turn it on, just like there was a person who had the authority to turn it off.
And we know how to do it. We know
Yeah,
how
that's
to
my
do it.
point.
We're not doing it. And it is getting lost in every other news story. And it can't because it's human lives. And it just even the fact that we're talking about AIDS feels like a throwback because of how much has changed because of good science.
Yeah, I wonder whether so it gets to the point, and I'm not a great advocacy person, but the issue is you start with the problem. In the article, I did the same thing. Start with the problem, and then talk about how we've been able to contribute to the solution, and then why that's not a bad thing for us to contribute to it, rather than keep starting with PEPFAR has been cut or USAID has been cut. Start with the problem and work your way the same way we're talking about it, which is you want to fix the system to make this outcome better. And that's how we need to talk about it. Because if we keep talking about it in terms of cuts and not cuts, you get into the debate about what should be cut, what shouldn't be cut. That was part of the program. We didn't like that. And that's all. Start with the outcome that we're trying to achieve and then say, what do we need to do to get that thing happening again? And that's how we need to approach it. And maybe then we'll get to the clutter of the noise around whether it's DOGE or it's USAID funding whatever people don't want us to be funding. That's a whole different story. But this is something that I think the administration wants to be funding, and we have to talk about it in terms of what they will solve and the value of it to them to solve it.
A month or so ago, I was part of an op-ed in the New York Times asking Secretary Rubio to focus on PEPFAR. Again, saying
I
the
haven't read it.
New York Times didn't quite title it the way we would want.
The headline wasn't great, but yeah, I
Yes, no,
saw it.
because the title was "We pro-lifers want you to save our
Yeah, yeah,
state."
it's
No,
true.
no, no. Focus on PEPFAR. Focus on PEPFAR. But Francesca, you were doing a beautiful job of talking about some of the people whose clinics this is impacting, the people on the ground. And as Dr. Ellen was just saying, there are a lot of players in this field. And but as you were mentioning, we're talking about religious sisters, we're talking about ministries where this is not like the US government went in and saved the world. It supported the people who are on the ground and have made sacrifices to be on the ground. Can you talk a little bit about that world, Francesca? That world that we support in such a beautiful and important way, or did.
Yeah, I want to just share something, an important activity that actually was part of the PEPFAR UNAIDS Faith Initiative and was a collaboration with the Vatican, but also was a partnership and collaboration with different stakeholders, which is called the Rome Pediatric HIV and TB Action Plan and Platform, which is the result of a series of dialogues that were hosted at the Vatican. And the purpose of these dialogues was to accelerate, and it still is, to accelerate the research and development, the introduction, and the rollout of optimal diagnostics and treatment for children with HIV and TB. And the beauty of this program, which actually, the interesting thing about PEPFAR, it was not, so PEPFAR doesn't do everything, but it leads, it helped to drive. And it helped to bring all these different stakeholders together. So it's a platform that brings together faith-based organizations, governments, the industry, so manufacturers, pharmaceutical companies, regulatory authorities, implementing partners, etc., and WHO and the UN, etc. UNAIDS, and they all come together. And the way this platform was structured was we need to look at what the problems and the major issues are around pediatric HIV and pediatric TB, and then look at and I was saying we are talking about diagnostics and medicines. Look at what the issues are, but then together just clearly indicate what each of these stakeholders, each of these important contributor to the global HIV response can do. So what is your commitment in order, and what is your action in order to address that problem? And then the last question was, what is that you need from others in order to fulfill your commitment and bring about change and solutions? And this is, and I invite everyone always to just search on Google, Rome Pediatric HIV and TB Action Plan. And one of the things that brought in terms of change was the acceleration of introduction and rollout of pediatric dolutegravir, which was and still is this miracle medicines for babies and for children. And that was just because we, through the support of PEPFAR, were able to bring together all these different stakeholders, because each one of them has an important role to play, as I said, in the research and development, introduction, rollout, and access. And each one of them could do so, and was very clear that I can do up to this point, and then you can do something else. It was key, for instance, to contribute to harmonization of regulatory systems for children for pediatric HIV. So that is what can happen, and what can be done when different stakeholders, which are united by a common goal, which was addressing pediatric HIV and TB, can do together. But they need a driver, and the driving force was PEPFAR. The other important piece that I wanted to mention is the pediatric HIV market. What we are doing, we are killing that market. If PEPFAR and a PEPFAR, which is a reform PEPFAR, where we bring in more clearly these transition plans where others can also invest more. I think if we don't do that, we are really gonna harm even more this pediatric market that we have created with so much effort through the last year. And I'm really concerned about the children and the families that are gonna suffer because of this. So I just wanted to share this because I believe that a partnership and working together is key to the response, and is something that can be done. But again, we need a driver, and that driver is still PEPFAR.
And when you say the market, can I just ask a question? When you say the market, are you talking about the pharmaceutical generic the drug making market, and that will disappear because there won't be a demand?
I'm talking about a market for the products that already exist that are in place, but also for the innovation.
Got it.
And the innovation is so key also for efficiency and reducing cost. And if we stop, we were talking about the importance and the relevance of having PEPFAR continuing supporting treatment access for people. Yes, but I also believe that the research and development part and the innovation and ensuring that the excellent innovation that exists for high-income countries can go also to low and middle-income countries. And that is something very important to ensure effectiveness of the response of the work on HIV, but also for health in general. We have long-acting for adults treatment and prevention. What about the children? And that part is where PEPFAR has been driving again a lot the change. But it's not the only organization, as we were saying before. It's not the only institution. So many others have contributed, but there are some who have contributed more, and we are grateful for that.
And so when you talk about the innovation in the market for children, for a selfish point for the West, I mean, could this have an impact globally, not just in lower income countries, in terms of children and medicine?
That it depends a lot, I believe, on the specific health system in countries. So each country is different. But, in terms of production, children living with HIV in high-income countries are a little number. Well, unfortunately, sometimes we think about numbers, we think about the disease, we do not think about the child as a person, and the investment might be reduced. But the situation is going to be very much, the generic market is going to respond to the request. And so if there is no investment, there's not going to be interest in moving ahead, moving forward. And again, who is going to pay is the children. In this case, I'm talking about children, but it can be adults as well. Every vulnerable population.
Well, and one of the reasons that PEPFAR is such a beacon, isn't it, is because Dr. Ellen, because we are supporting faith-based groups to a large extent that see the human person. DOGE, God bless them, everybody has a role, right? DOGE isn't necessarily looking at the human person, right? It's looking at these monstrosities that are bureaucracies and plowing through them. But this is the best of humanity, not just the best of America. Looking at the human person, treating the human person, encountering the human person, walking with the human person. You must have so many stories about the amazing things people are capable of when they have a little support.
I am overwhelmed by it. I mean, I'm overwhelmed by the commitment that people have to humanity and to other people's lives. It can overwhelm you when you watch people and we don't, if you walk around the everyday life, people talk about paying it forward, picking up the dollar, giving to the next person. In the US, it doesn't come across as clear. But when you're in a middle or low income country and you're talking about an HIV infected child, and you really see how compassion, love really are, and that's then manifest in treatment and everything else that is really essential to the human condition. And it's why the faith-based organizations align with it, because it aligns with what humanity is and a vision and a future. And so in my life, I've seen more. It's usually finding people on the fringes in the U.S. where you see people who are committed to helping them. People who have mental health conditions, people who have drug addiction, and trying to help them. Internationally, you see food insecurity, food deprivation, and you see the people working that, and they got up in the morning and they said, "This is what I'm going to do with my life," and they commit to it. And where they find their faith for doing it comes from many places, but that's what they commit to. And it's overwhelming to see people who make that selfless commitment. It really is. And every time you run across one, you just figure out, where did they come from? I mean,
Mhm.
but a lot of times, like you said, it's their faith.
And so often, if we were really living, those of us who are faith-based, if we're really living what we say we are, the world would look a lot different.
Yes.
How did you get involved in this work?
Myself?
Yeah.
Oh, well, so I was in an area in Philadelphia when I was in training where it was a very poor area and there were a lot of injection drug users. And so HIV was being spread from men to women through injection drug use and then women to men. And then the babies started coming in. And I wasn't in the Bronx, but I was in a community that was similar. And then we started seeing the babies coming in when I was a resident in pediatrics, and we'd start seeing the babies in the unit. And everyone was scared to death when it all first started happening because no one knew anything. So then
Right.
I started trying to figure out how to get people to stop being scared and myths. So I started doing a lot of research about it. And then I moved to San Francisco before in 91. And, antiretroviral therapy didn't come out till 95, 96.
Mm,
For 5 years, people were just dying.
mm,
And you got used to that. And so I got involved in it there. And then I moved to Baltimore And in Baltimore, it was the same thing as what I was in my residency. It's a poor community, and you have a lot of HIV transmission going on there. And so I got into both research and treatment around HIV domestically. And then eventually I worked, I had young kids. So I told her when I'm not going to travel. And then my kids got older and I started doing international work. And my big thing was always about figuring out how to do structural change, building capacity, looking at things that were getting in the way of delivering treatment, transmission, and trying to figure out ways to bend those kind of barriers to treatment and testing that were going on. And so then I spent the rest of my career trying to figure out how we could do that from a research and prevention. And then for a while I ran public health programs around syphilis. So it was the same kind of community engagement, the idea of testing and treatment. So it's been my life for this long time, and to watch it happen, what's happening now is just heartbreaking. And I understand the larger picture of what DOGE is doing, but I think this is a case where you start with the problem, and I think the people, the person, as we're talking about, and you work your way back to what we need to do to help that person and why we have to help that person. And I think that once you make that commitment, like everything else, like you said, people wake up one day and you make it happen. And if you want to make it happen, like you said, we've proved it can be done. So do it. And I don't know I don't know how we can help, but just make awareness that it's possible to turn it back on and we can do it consistently. And if you want to fight about some of the prevention, behavioral prevention, and some of the campaigns, fight about those. But the treatment issue and the support issue and the caring issue and the love issue should be brought back to life.
And what is so critical about raising attention about this is it's so unnecessary what's happening right now.
Yeah.
And as has been pointed out here, I have no reason to believe that Marco Rubio does not want to save this program. And I think the administration wants to save this program, and it's just getting lost in the midst of this chaos. And it
Yeah.
can't because people are dying.
People are dying
Yeah. Yeah.
today.
Francesca, so if you had a few minutes with Marco Rubio, from your perspective as an outsider to the United States, you're coming to us so generously. We're recording this at like 10:30 at night, your time, 10:40 at night, in Geneva. Thank you for doing that. But if you had a few minutes with Marco Rubio, and I think all of us here, we want to help. We just want to help. We're not trying to be critics of the administration. We're trying to say, hey, you've got a good thing. You can fix this good thing and make it go again. And frankly, be a hero to millions of people. Francesca, what would you tell him?
I would tell him that PEPFAR has been saving lives, and that is thanks to the generosity and the beautiful way of caring of your country. And I think that this should not just stop, because what you want to do is to get things done better. And to do things better, you need to put an additional effort on really looking into improvements that should be made. But at the same time, you need to work even further in collaboration with other partners to understand what is the additional role that each one of them has to play here and now. Because he's right, it's not a solo responsibility of the United States of America and of its people. It's really about finding a way to do sharing mutual responsibility in a more strategic way. And as you said, you have had people coming back from the space, and you could figure that out. We can figure out a way forward. We need to focus, and that is going to require some effort. We need to focus on transition plans, but those plans are going to be done if the United States of America doesn't go away. Because really, what you have done is a miracle.
Mm.
It's beautiful, and PEPFAR is effective and is accountable and gives results and impacts, and it saves lives. So just don't waste everything you have done. You can be a hero. I really believe that.
Yeah, and we hear so many awful stories in the news, right? But PEPFAR is such a an example of story after story after story of, as you say, miracles. And it's such a source of hope. It should be such a source of hope, and something honestly that we can it should be the honor, one of the honors of our lives to do anything to support this program. And both of you, I know, have just countless stories about the honors you've been able to participate in because of this. And I'll ask you, Dr. Ellen, yeah, the same question. If you had a few minutes with Marco Rubio, a million people hitting him with everything, what would you say to him to make this easier? Do you have any candidates for your czar? Do
Exactly.
you want to
I
step up
do
for
want to
service?
czar, but remember, we're talking about we can get away. I mean, again, to sort of fit into the paradigm that's going on right now. You don't have to call it USAID. You don't have to call it. I have to say, what are the programs that were funded that support the implementation of PEPFAR? Figure out what those programs are. I think Francesca made a really important point is then, you have a plan for restarting those programs, but also with the idea towards figuring out to actually make more clear to I would say the administration that the collaboration of other parties in this discussion. And I think Francesca's point is that there's a place for greater collaboration, there's a place for innovation, and all of those things are not hard to achieve if you lay out what your goal is. I mean, that's my thing. And particularly in this particular space where people are motivated by goodness and kindness, you're not fighting over who's going to get richer.
Right.
You're not fighting over, who's going to, and most of these people don't care about the glory. So you're not fighting egos. They just want the kids to live. They want the adults to live. They want people to feel and be alive and well.
And there's no political reason for anyone not to support this.
Right.
Um, I was just on a completely different issues in some respects. I was just in a green room with Senator Schumer. Don't agree on a lot, but he has a new book on anti-Semitism, something we can all support him with. But what were we talking about in the green room? Obviously two people who don't share most of the same politics. We were talking about his Passover Seder and his grandchild on the way, and that this is what this is about. This is about supporting children, parents, um, and making sure that people can not only flourish but live. And as we've said, we know how to do it, and so we really have to.
Yes.
We really have to. This is a conscience issue, I think, for our country, to the extent that a country has a soul or a conscience. But we talk about that metaphorically. But for all people of goodwill, this is something that we can't let get lost in this process of cleaning house, which the cleaning has to happen. But
And that's
people
why I say we start with the disease. Let's not talk about the cleaning of the house and the process there. Let's talk about the children. Let's talk about the parents. And let's talk about HIV and start there and work our way back rather than talking about scalpels and sledgehammers and all this other stuff that's out there that gets us into a political battle about whether anything needs to be cut, what kind of things need to be cut. I think if you start with the problem and the solution, being what we do, and what it yields and its effectiveness and its kindness, you can get a different kind of response in terms of getting coalitions to fight for this.
So as Francesca said, let's get the cover-ups off the Sistine Chapel. Let's get the astronauts out of space. Let's get people their medicine. Let's
There you go.
make sure people don't have to die in this process.
Yep.
So uh, Dr. Ellen, you have a website, is Jonathan Ellen
Dr. Jonathan Ellen. Yeah.
.com.
Yeah.
And you wrote a piece for National Review Online, Aid to Fight AIDS is Money Well Spent. So people can take a look at that. I also was part of this op-ed on PEPFAR in the New York Times. You can Google that as well. And we'll put this at the bottom of the YouTube link, these links. And is there anything, Francesca, any groups, any organizations you want to have people focus on to support, to get more information?
Yes, I would suggest and ask everyone to follow the Elizabeth Glaser Pediatric AIDS Foundation work and messaging. They are doing and they have been doing through the years an incredible work for children in the United States and abroad, including, I mean, even the story of Elizabeth Glaser is a very powerful and beautiful story. But what the organization has done, I think, is very, very important. What they're still doing is very important. And they have a lot of useful information about children and HIV, and in terms also of messaging to people. I think what you said before is we can do if we care. And I think one of the problems is that people do not know. That's why they don't care. And we need to make sure that they do know so that they care. Another thing I wanted to mention is on the 8th of April on the Lancet Health Policy, there was a very interesting and important article about the impact of PEPFAR for children. So I just encourage people also to have a look at that with important data, which also look at the collateral benefits of, as Dr. Helen was mentioning at the beginning, the collateral benefits. So I would encourage people to look at them. And yeah, I think this is all. Thank you.
Well, Francesca Merico, Dr. Jonathan Ellen, I'm honored. Kathryn Jean Lopez from National Review and National Review Institute, honored to be able to talk to you. Thank you for your time, and thank you for the work that you're doing to save lives. And I know these are high holy days for Christians and Jews, and I know there are a lot of prayers that this gets fixed, and this gets fixed now, because it's necessary. Thank you both.
Thank you.
God bless you.
Bye.
Thank you. Bye.